So, laparoscopic surgery, I'm going to talk a little bit about the history and background, talk a little bit about the current status and utilization. You saw some data already. I'm going to try to give you some more recent data, which we recently pulled off of a couple of databases, and then we'll talk about the barriers and then try to draw some conclusions. Some of this has already been touched on from the earlier talks, which were all excellent. So, we know that we see the patient on the left, we see the patient on the right, and yes, Howard, we do have a few patients that are obese in California. Not as many as you guys have with those the cheesesteak heaven. But looking back, history, 1901 was the first laparoscopic procedure described by Kelling on a dog, and you'll see later on, 1923, he actually published his first 22 years of minimally invasive surgery. We've had a few other people since that time. Gynecologists were actually early to the game, if you would, in the 70s. General surgeons, the first laparoscopic liver biopsy in 1982. But really, the landmark event was, of course, the laparoscopic cholecystectomy in 87 and 88, sort of competing claims for who was first. Move forward now into 1977, first lap appendectomy. 1983, SEM did the first complete laparoscopic appendectomy. That is, it was actually resected intra-abdominally as opposed to through an extraction site. And then Moises Jacobs did the first colectomy, which was lap-assisted, reported that in 1990, which by coincidence was the same year I finished my general surgery residency training. So needless to say, I didn't get a lot of experience during my general surgery residency training. I think I fourth assisted on 3 or 4 laparoscopic cholecystectomies. And then Dennis Fowler reported the first laparoscopic sigmoid resection later that same year. And then we had a few other reports coming out. And then 1991, the first complete laparoscopic, if you would, intracorporeal right hemicolectomy. And that was also the year I finished my colorectal training, which once again I had no opportunity to have any experience because it wasn't being done in really any of the training programs in 1990, 1991. So, and since that time, of course, things have changed quite a bit, and I would say that the conversion of most of what we do from open to minimally invasive surgery is nearly as dramatic and a revolutionary change as recognizing that the world is not flat, despite the fact that there's a handful of NBA players who don't believe that. It is indeed true. And despite sayings earlier talk about the value of minimally invasive compared to open, it actually is a significant advantage and benefit, and I'll show you some data on that. Having said that, I completely agree with him, which is that's not far enough. We need to go farther, and I'm totally on board with the endoluminal approach, and that's where we'll eventually get, I believe.